Welcome to our deep dive today. We're going to be talking about LPA, lipoprotein A. It's getting a lot of attention in the cardiology world, and we had a really interesting discussion with a couple of experts. The thing that really jumped out at me was this idea that high LPA can be, for some people, totally genetic, meaning that all the lifestyle changes in the world might not really make a difference.
Yeah, it's definitely a shift from what we've been taught for a long time.
Right, like diet and exercise are the key, but LPA kind of throws a curveball in there.
It really does.
So to kick things off, can you give us just a quick, what is LPA?
Yeah, so you can think of it as kind of like LDL cholesterol, the bad cholesterol, but with an extra protein attached, and that's called apolipoprotein.
Lipoprotein, okay.
And here's the thing, about 25% of the global population has got elevated LPA, just purely based on their genes.
So you could be doing all the right things, eating right, exercising, and still have high LPA just because you inherited it.
Exactly. And we've actually seen people with genetically high LPA who have really good cardiovascular health despite maybe not living the healthiest lifestyles.
That's so interesting, but also kind of confusing. So if it's linked to heart problems, how can that be?
Yeah, it's really interesting, and it's kind of like a medical mystery still.
Mm-hmm.
And it really, I think, emphasizes the point that context is everything, right?
Okay.
LPA might be more of a marker or a signal
Hmm.
rather than a direct cause of heart disease itself.
Okay, so if somebody finds out they've got high LPA, what should they do?
I think monitoring is key. I would say get your LPA checked a couple of times a year, maybe 2, 3 times a year, and get a sense of what your trends and your fluctuations are.
Okay, so multiple tests make sense because one reading might be misleading.
Exactly, because you want to be able to distinguish between what is consistently high LPA
Sure.
versus just those sort of temporary spikes that you might get from if you have an infection or inflammation or something going on.
Okay, so look for patterns rather than just one data point. But how do we know if that high LPA is actually doing anything? Actively causing problems.
Yeah, that's a good question. That's where LPPLA2 comes in.
LPPLA.
So LPPLA2, it's another parameter that we measure that indicates how much of that LPA is busy repairing oxidized molecules in the body.
Okay, I'm going to need an analogy here to really wrap my head around that.
Sure. So imagine LBA is like a mechanic
Okay.
who's specializing in fixing up damaged molecules.
Okay.
And LPLA2 tells us how busy that mechanic is.
Right.
So if you've got high LPA and high LPPLA2, that mechanic is working overtime. And that could signal a higher risk of those heart problems, even if your high LPA is genetic,
So a busy mechanic is a red flag.
pretty much.
What if my LPA is high, but my LPPLA2 is low?
Then that means that your LPA is not under a lot of stress.
Hmm.
It's kind of like having a mechanic on standby, ready to go if they're needed,
Mm-hmm.
but they're not, not overwhelmed at the moment.
That's reassuring. Now, I read something about vitamin C and LPA. Can you explain that connection?
Yeah, so there's a theory that individuals with genetically high LPA might have a decreased ability to make collagen in their arteries.
And collagen's super important for artery health, right?
Absolutely.
Yeah.
Provides the strength, the flexibility.
Okay.
And vitamin C is really important for the production of collagen.
Yeah.
So the theory suggests that LPA might be acting as kind of like a backup system, compensating for those lower vitamin C levels and actually protecting those arteries from damage.
So even if somebody can't change their genetically high LPA, focusing on antioxidants like vitamin C could still be a good strategy.
Yeah, exactly. Reducing oxidative stress is a key tactic for a lot of people who are managing high LPA risk.
Interesting. So it's not just about lowering the number, but understanding what else might be going on in the body.
Totally. It's about the bigger picture.
Okay. And speaking of the bigger picture, let's talk about dietary fat. I've always heard that less fat is better for your heart.
Right.
So how does that play out with LPA?
It's not always that straightforward, especially when LPA is in the mix.
Wait, are you saying that eating fat could actually be beneficial for people with high LPA?
So there's some emerging evidence
Okay.
suggesting that restricting dietary fat might actually backfire and increase LDL cholesterol levels in some cases.
Wow, so the opposite of what I thought.
Yeah, it's kind of counterintuitive.
Are there any real-world examples of this?
Yeah, so there's a case of a journalist named David Wildman
Okay.
who decided to experiment with the ketogenic diet.
Ketogenic, so that's high fat, low carb, right?
All right, high fat, low carb. Yeah, very unconventional approach for somebody who's concerned about their cholesterol.
Exactly, yeah.
But his cholesterol levels actually dropped significantly after he adopted that diet.
That's incredible. So how does this tie back to LPA?
Well, what we're learning is that individuals with high LPA, whether it's genetic or not,
Okay.
they might see their LDL levels actually rise if they cut back on fat too much. So almost like the body's trying to compensate for that lack of dietary fat.
So embracing healthy fats, could that actually be key for managing cholesterol for some people?
It seems counterintuitive, but in some cases, it might be the most effective approach, yeah. And this is really relevant for anyone with high LPA.
That's so interesting. It really challenges the traditional thinking about fat and heart health.
It does, and it just highlights how important a personalized approach is. What works for one person might not work for another,
That's a good point.
especially when you're dealing with something as complex as LPA.
So much more to this than we initially thought.
Absolutely. It is
Yeah.
kind of counterintuitive.
It really is. It makes
Yeah.
you think twice about all those low-fat products
Right.
that we've been
Yeah.
conditioned to buy.
It's interesting.
So just to recap for people listening, we've got this LPA molecule. It can be high because of genetics. It might be connected to heart health. But it's not as simple as high LPA equals heart disease.
Right. And then we've got this LPPLA2,
Right.
which kind of gives us a little snapshot of how active that LPA is.
Like measuring its workload?
Exactly, yeah.
Okay.
And then we've got this theory about LPA potentially compensating
Right.
for people who have genetically high levels
Yeah.
and might not produce as much collagen.
And then we can't forget that whole dietary fat thing.
Oh, yeah.
That cutting back on fat might not be the best strategy,
For some people, yeah.
particularly with high LPA.
It really shows that a personalized approach is really important.
Yeah.
What works for one person might not work for somebody else, and especially when we're talking about something as complex as LPA.
It's almost like we each have our own LPA profile and we need to learn how to interpret it
Yeah.
for ourselves.
Absolutely.
And that's where, monitoring and working with a doctor or healthcare provider who understands these things can really help.
Yeah, for sure. Definitely.
So it's not just about lowering it at all costs.
Not necessarily. It's really about understanding what it's doing and if it's actually posing a risk in your individual situation.
Right, because you were saying there are people who have high LPA who live long, healthy lives and don't have any heart problems.
Yeah, absolutely.
Okay, that's good. That's reassuring. So what about people who don't have the genetically high LPA? Does any of this apply to them?
Of course. Because remember, LPA can fluctuate
Right.
for a variety of reasons.
Yeah.
Even if you don't have that genetic predisposition, you can get these temporary spikes in your LPA, whether it's because of inflammation or an infection or even like hormonal changes, like if you're menstruating.
Oh, wow.
Yeah, so many things can affect it.
So it's still worth keeping tabs on, even if it's not, a constant concern.
Yeah, I would say so.
Okay.
And the same principles apply, like monitor your levels, understand your individual trends, what's normal for you, and work with your doctor to interpret the data.
It all comes back to that informed self-care,
Exactly.
being an active participant in your health.
Love that.
So what was it that first sparked your interest in LPA?
It was kind of the puzzle of it.
Right.
Like this molecule that's been around forever. And we're just sort of starting to understand, like, how complex it is and how it functions. And
Yeah.
it was just like this scientific detective story waiting to be solved.
I love that analogy.
Yeah.
And it sounds like there's a lot more pieces of this puzzle still out there.
No, for sure.
Yeah. You had mentioned earlier about LPA potentially having roles beyond just cardiovascular health.
Yeah.
What else might it be involved in?
Well, for example, some research suggests that LPA might actually have anti-cancer properties.
Wow, okay. So this so-called bad cholesterol might actually be helping us fight cancer.
It's still really early,
Yeah.
but the early research is really fascinating.
Okay.
Seems like it might actually interfere with the growth and spread of certain cancer cells.
That's incredible. It just goes to show how much we still don't know
Yeah.
about this fascinating molecule. I'm curious, are there any common misconceptions about LPA that you encounter a lot?
Oh, yeah, definitely. I think one of the biggest ones is that if your LPA is high, there's nothing you can do about it. And while it's true that genetics plays a really big role, there are still things that you can do to potentially manage your risk, like we've been talking about.
Okay.
Another common misconception is that high LPA automatically means you're going to get heart disease.
Oh, right.
And that's not true at all. It's just one piece of the puzzle.
Right. Right.
So, yeah, it can cause a lot of unnecessary worry and anxiety for people.
Yeah, I can see that. Really highlights the importance of talking to your doctor and getting good information.
Absolutely. Knowledge is power.
Right.
And the more you understand about LPA and what it might mean for you, the more you can make informed decisions about your health.
For sure. You mentioned earlier that LPA can fluctuate. So besides genetics, what other things can cause it to fluctuate?
Well, things like if you have like an acute inflammation or an infection, or even like hormonal changes like during your menstrual cycle, that can actually cause your LPA to spike up temporarily.
Wow, interesting.
Yeah, so that's why it's so important to look at those trends over time and not get too caught up in any single test result.
Like we were saying before, it's about understanding the context
Exactly.
around the number.
It's like being a detective. You know,
Yeah,
you're piecing together all the different clues to kind of get a clearer picture.
it really is. It makes you wonder, like, what other hidden connections, what other things are we missing?
Yeah, that's what makes it so exciting, you know?
Right.
Science is just this constant journey of exploration and discovery.
Yeah.
And, you know, with every new little bit of information we find, we gain a deeper understanding of, you know, ourselves and the world around us.
My mind is officially blown. We started with LPA and heart health, and now we're talking about it possibly being able to help us fight cancer.
I know, it's crazy.
And we're not even done yet.
There's so much more.
There's so much more. But before we move on, I want to just make sure that people listening understand. While it can be influenced by genetics, it's not a death sentence. There are things that people can do to understand and manage their risks.
Absolutely. 100% agree with you. Don't let the fear or misinformation paralyze you.
Yeah.
Arm yourself with knowledge, stay curious, and work with your healthcare provider to make the best decisions for your health.
So important. It's amazing to think about this tiny little molecule,
I know, right?
LPA, and how many effects it can have.
Yeah, it's
It
crazy.
just shows you how everything in the body's connected.
It really is, yeah. The more we learn, the more we realize how much we don't know.
Right.
But that's what keeps it so interesting.
Yeah.
There's always something new to discover.
So for our listeners who maybe just tuned in and are hearing about this for the first time,
Yeah.
what would you say is the most important takeaway from this whole conversation about LPA?
I think the key takeaway is that LPA is complex and its role in our health is still being figured out. You know, it's not as simple as high LPA is bad.
Right.
We have to consider genetics, lifestyle, you know, individual trends, how it interacts with LPPLA2, antioxidants.
So many things. Yeah.
Yeah.
It's about the big picture.
Totally.
And I think this has really highlighted the importance of being curious
Yeah.
about your health
Absolutely.
and really understanding, being an active participant.
Knowledge is power.
So if somebody's listening to this and thinking, okay, this is all very interesting, but what does it mean for me? What would you say is the next step for someone who's concerned about their LPA?
The first step is to talk to your doctor.
Okay.
They can order a simple blood test to measure your LPA levels. And then from there, you can work together to create a personalized plan to manage your risk. And that might involve lifestyle changes, medication, or even just monitoring your levels over time.
So it's about taking that active role
Absolutely.
and being proactive,
Yeah, for sure.
not just waiting until something happens.
Exactly. And remember, like we said, information is power. The more you know about LPA
Right.
and how it could potentially affect your health,
Right.
the more you can make those informed decisions.
So to wrap things up, I just want to leave our listeners with one final thought.
Yeah.
Don't underestimate the power of curiosity.
Oh, I love that.
Never stop asking why
Yes.
and seeking out information.
Totally agree. Stay curious, stay informed, and be engaged in your health.
And who knows,
Yeah.
maybe you'll be the one to make the next big discovery about LPA.
Exactly.
Well, thank you so much for joining us for this deep dive into the fascinating world of LPA.
It's been a pleasure.
And until next time, stay curious.